What's going on, guys? Welcome back to W.D.Y.D CSP, what you do as a central sterile processor. Alright guys, I've shown you how to leak test a GI scope. I've shown you how to manually clean a GI scope. I've even shown you how to do the cleaning verification for a GI scope. Now I'm going to show you, after all those steps, how to load it into an AER. Now, every AER is different. This one is a specific brand with a specific technology that is considered a touchless technology. And I'm going to show you how to load it for this specific unit. All right, so again, a disclaimer, this is not a patient-ready scope, and it's not going to be processed for patient use. Little thing about the basket, you notice that the basket has a shallow end and it has a deep end. Okay, the deep end of the basket is where you want to put your light adapter or your light connector and your control body. So let's go ahead and sort this out here. Okay, it's important that when you put your control body in the deep end, that the knobs are facing up. Okay, when you're placing your light adapter or your light connector, I keep calling it adapters and a connector, you're going to place it so that it's horizontal with the back end there, and you're just going to coil your insertion tube so that it's not flopping all over the place or fraying. So this is the orientation that you want to place your scope into this basket. Reason being is, on the deep end, you want as much contact with the detergent and the disinfectant, so that's going to be kind of submerged. There is a spray force in this AER, but it's better to have it submerged with the most contact possible, and then the other end is going to get the spray force and some submersion. Okay, this uses what's called connector blocks. Connector blocks are specific to scopes or scope cannulas. So this one here has, I believe, 6 connectors. So we're going to go ahead and connect this this block here. Okay, make sure that you place your block on the way it would go into the unit. And most of the connections are on the light connection of the GI scope. You have your suction valve, you have your air tube, you have your air water inlets, and you have your auxiliary connection, as well as your venting port. So we're going to connect all those. And then on the control body, we need to put a connection on the biopsy port, and then we have to block off the suction and water channel. So connecting everything, and again, once you do this a few times, it's basically muscle memory. Knowing how to set this up, it's not very difficult. It's almost impossible to mess this up. It's just you have to be familiar with the scopes, with how many channels, and picking the right blocks. Honestly, pretty simple. Just connect appropriately, make sure all your connections are there. And again, this unit will tell you if you're using the wrong block for the wrong scope. So it pretty much is a smart system in that you can't place the wrong block with the wrong scope. Now again, as I stated, this is not a patient-ready scope, so I will not be running that AER because it's not barcoded or inputted into this system, so I can't run it. But maybe in the future I will do a video showing you how it runs with a real scope inside. Now we're going to go ahead and place it in the AER. We want to make sure that when we place it in there, that your connector block is seated properly and then locked into place. Okay, it's important that this is locked into place properly. Everything is nice and organized. The hoses that you connect are out of the way of any moving parts in there that may possibly get tangled up or anything, because there is a rotating sprayer on the bottom. You want to keep the hoses away from that area so that it doesn't impede that spraying force there. So this is pretty much it right here, guys. This is the final thing, and then it would be scanning to start the unit, scanning the scope, scanning the block, putting your ID, and that would start the unit up, and it would monitor all the pressures and go through all its phases to disinfect this unit. All right, guys. So as always, stay true to yourselves. Keep it 100. Continue educating yourself. Until next time. Peace, guys.